Executive Director Jessica Altman and the rest of Covered California working hard to make sure that no one is left to face the medical behemoth on their own. She is with me now live. Good morning.
Good morning. Thanks for having me.
Definitely. So what exactly is happening here? Californians are getting dumped off Medi-Cal?
Yeah, so normally the Medi-Cal program, which you have to meet eligibility requirements for, goes through a process each year where they recheck everything about your information. They check, is your income the same, or did it go up and you no longer qualify? And that process was put on pause during the pandemic, ultimately with the goal of keeping people covered, of making sure that people had health insurance coverage throughout that time when healthcare was top of mind for everyone. But as we renormalize, as the end of the public health emergency federally comes about, that process is going to start again. So Medi-Cal is going to restart those checks and looking at your information. And that does mean that there will be people currently on Medi-Cal that will ultimately be redetermined no longer eligible. But what we're here to share is that there are other places that you can get coverage, maybe through your job or a family member's job. But Covered California is also here to provide you coverage to make that process as easy as possible. And we do offer significant financial assistance.
Alrighty, now according to the government's Consumer Financial Protection Bureau, nearly 1 in 5 American households has some form of overdue medical debt. The latest figures show 43 million of us have unpaid medical bills on our credit report. So even if someone is willing to ignore this as a health and wellness issue, this could be a household financial issue, right?
Of course. I mean, healthcare costs a lot. And when you don't have coverage, right, is when you may still need healthcare, and then you're going to see the full costs associated with that. I do think it's important to talk about affordability when we talk about Covered California. I mentioned earlier that we offer financial assistance. In fact, over 90% of those that we cover are receiving financial assistance. 2/3 of our enrollees have access to a plan that costs them $10 or less per month, and many have coverage that costs $0 a month. We also offer for many help with those out-of-pocket costs like copays and deductibles. So we are really here for us. The more you need in financial assistance, the more you're eligible for. And we want to make sure coverage stays within reach, even if you are one of these people who will be transitioning off of the Medi-Cal program and need coverage from another source.
I was going to ask you about that $10 a month figure a little bit later coming up here. That is an incredible price when you think about how burdensome healthcare coverage can be for families. So that is important for everyone to know. Now, 2 days ago, we reported on a new survey by the Pew Research Center showing that 62% of respondents said paid time off was extremely important as part of their work life, ranking it above employer-assisted healthcare coverage. Given your business, your mission, that news must be really hard to hear. What do you want to say to folks who are thinking, oh, paid time off or something like that, that's more important. There's something that's more important than me insuring myself and my family?
Well, I think everyone has to make their own choices, but healthcare, we just went through a pandemic, right? We have seen that healthcare is a need sometimes when you know you need it and sometimes when you least expect it. So having health insurance coverage is both about investing in your health, investing in your family's health. Every Covered California plan covers the nationally recognized preventive healthcare services at no cost to the patients. You can get those cancer screenings, those vaccines. But as we look forward, it's also about that protection of the thing that you might not know is coming and having that security to protect yourself and your family in that situation.
You're 1 day into a new ad campaign to tell people about the fact that they may get dumped off Medi-Cal and that Covered California is their best option to keep their families protected. How is that working, and why did you think this virtual kind of media tour is the best way to reach people?
We want to make sure people understand what is happening. And frankly, our goal is to make sure that no one is simply dumped off of Medi-Cal, but rather they're helped to transition to the form of coverage that makes sense to them. And for many people, that is going to be Covered California. So we are working hand in hand, totally coordinated with the Medi-Cal program to make that process as seamless as possible, to share collectively with consumers, with families in this circumstance, what is happening, what their options are. Medi-Cal will give us the information that we need to go ahead and say, here's what plan may be best for you, here's what your financial assistance is going to be, and ultimately the cost, and make it as simple as just doing one thing to keep coverage for Californians. So again, really want to make sure that that handoff is as smooth as it can possibly be.
You use the word seamless, and that's something I think is going to give people a lot of comfort, because a lot of, filling out this, filing that for anything medical, not even in this situation, is very confusing to families. So if you can help them with a seamless process, I know that will be appreciated. So if someone wants to check their status, get connected with a covered California counselor, get started with insurance, they can go to benefitscal.org.
Yeah, benefitscal.org is the Medi-Cal website and a great place to start, especially if you're still going through that process of being redetermined for eligibility for Medi-Cal. Because first and foremost, if you are still eligible, we want to keep you there. That's exactly where you should be. But for those that may no longer be eligible for Medi-Cal, that may be looking for coverage, Covered California is always here to help. You can visit us at coveredca.com. You can call us at 1-800-300-1506. We also offer in-person assistance in addition to online and over the phone, and do so in language for any individuals or families that would like to be in a language other than English.